Hi, this is Dr. Wayne Gard. Today I want to have a chat about hip pain. Lots of patients come in and say, my hip is giving me trouble. But when we talk about the hip, we often say, well, where is the hip pain? And people will point to three main areas. They'll point to the front of the hip here, they'll point to the side of the hip here, and they'll point to the back of the hip here. So what are they actually pointing to when they're pointing to those three areas? Well, if they're pointing to the back of the body, then it's usually not the hip itself, it's more likely to be the alignment of their pelvis. When they're pointing to the side of the hip here, then it's more likely to be a problem with the muscles down the side of the thigh there. When they're pointing to the front of the hip, then they're actually pointing to the hip bone. The hip bone actually sits sort of in the groin and not sort of out to the side here. So when someone points to the front of the hip, then that's actually the hip bone itself that needs to be worked on. So first of all, we determine where the exact hip pain is, and then we work on the structures involved that are causing the pain and discomfort. So if you're having hip pain, it's a really common problem, come in, we'll check it out and give you some help. Thank you.